What causes acne? There is no exact cause for acne. There are several factors that doctors think bring on this problem for many people. One of those important factors is the hormone level in the body. There is no exact cause for acne. There are several factors that doctors think bring on this problem for many people. One of those important factors is the hormone level in the body. The hormones are called androgens and increase in both boys and girls when they are going through puberty. This is the reason why there are so many pre-teens and teenagers that have to deal with acne get some form of acne medication to treat it. Another cause of acne is genetics. If a child has a parent that had to deal with a lot of acne problems as a child, then chances are they will too. When a pre-teen or teenager sees that they are having a problem with acne, it is important for them to seek acne medication to help fight this problem early so that there are no long-term effects of the acne. One factor that can cause acne in girls is their menstrual period. This is a time when hormones are really active, and this can cause a flare-up of problems in most pre-adolescent girls. There are many acne medications that can treat this problem and get their skin looking perfect again over a time period. It will take time for the skin to clear up and get back to normal. Pregnancy and birth control pills are another reason why women get acne. When a woman is pregnant, this is a time when her hormones are changing and all different things are happening to her body. Birth control pills are another source that will cause women to have an acne problem and have to resort to acne medication. Certain medications that people have to take can also cause acne to occur in certain people. This is typically normal and can affect just about anyone. Usually once the body accepts the medications, the acne will stop or at least lessen. There are acne medications to help when this is the case. Certain fabrics as well can cause acne to appear also. Wearing tight collars, backpacks, and hats can bring on a case of acne on any part of the body. That is another factor. Acne can be on any part of the body. It is not just limited to the face. When acne appears on different parts of the body, you may be able to control it with over-the-counter medicine, or you may have to go to a doctor for your acne medications. There are many myths of way acne starts, like chocolate or greasy foods. However, there are no actual links to these rumors and it is not proven. However, in some cases a person's diet will affect their skin, and why it is important to have a healthy, well-balanced diet so that you do not need acne medications in the future. What causes acne and how to control them? There are many factors that causes acne from young to adult. Control acne at early stage is important to prevent scarring. Learn the best way to control acne. Acne begins in puberty, but it does not always end there. Every teenager, if examined closely enough, will show some of the effects of acne, with some being mild, others more severe. The major hormone causing changes in teenagers is androgen. Under its influence, the sebaceous glands produce more and more sebum oil. This leads, then, to oily skin and a change in skin flora. There is an increase in the bacteria that cause acne as well as a type of fungus. All these contribute to the development of blockages at the oil gland openings known as comedones. Such blockages cause blackheads and whiteheads and acne when there is infection of the skin's pores. Acne should not be viewed as something that comes with puberty. It has lasting effects on the skin, like scarring, and should be treated. A gentle skin cleansing without using cleansers that over dry skin should be established. Addition to that, a supplement such as acazine should be taken to have a fast and effective acne cure inside out. In adults, acne could be a carryover from adolescence, occupational exposure to chemicals or other skin irritants in the workplace, drug-induced. Some medications exacerbate acne or cosmetic acne. There are also other factors that may contribute to acne besides family history, such as frequent use of thick makeup, frequent activities under hot and humid conditions, and contact with oily substances. There is nothing much that we can do about genetics, but surely we can do something about lifestyle factors to prevent acne. Using thick, oily creams also may lead to breakouts too. People with acne should use products that are formulated for people with oily skin. Stress is another common aggravating factor for acne. Lack of sleep is a form of stress in itself too. And for women, the menstrual cycle can trigger off acne too. But whatever your stage in life with acne, if the acne cream or lotion show no sign of clearing up, then get Acazine. Acazine is rate number 1 acne treatment product with guaranteed results. It works for adults or teenagers suffering from facial or body acne. This is a natural acne treatment formula with no side effect and highly recommended by dermatologists. Fast and effective acne cure from inside out. Treating acne at the start of the problem is easier than dealing with the scars. What causes adult acne? Main reasons why do acnes grow on adults? Regardless of age, acne is a condition of the sebaceous glands. These glands are attached to hair follicles and produce an oily substance called sebum. An acne lesion forms when a hair follicle becomes plugged with sebum and dead cells. The pathogenic events in the sebaceous glands are believed to be due in large degree to changes in levels of androgenic male hormones in the body, a circumstance usually associated with the growth and development that occurs between the ages of 12 and 21. Therefore, it is important to look for an underlying cause of acne that occurs for the first time in adulthood. Acne that appears after 25 to 30 years of age occurs for one of these reasons. 1. Recurrence of acne that cleared up after adolescence. 2. Flare-up of acne after a period of relative quiet, for example, during pregnancy. 3. Occurs for the first time in a person who had never previously had acne. Acne that appears for the first time in adulthood should be examined by a dermatologist who can investigate the underlying cause. Some causes of adult acne are: Number 1, medication. Some medications that can induce acne include anabolic steroids, sometimes used illegally by athletes to bulk up, some anti-epileptic medications, the anti-tuberculosis drugs isoniazid and rifampin, lithium and iodine-containing medications. Number 2, chronic physical pressure on the skin. Chafing from the straps of a backpack or tucking a violin between the jaw and chin can cause chronic physical pressure on the skin and may induce a condition known as acne mechanica. Number 3, chlorinated industrial chemicals. These may induce the occupational skin disorder known as chloracne. Number 4, metabolic conditions. Changes in the hormonal balance, such as those brought about by pregnancy, menstruation or hormonal abnormalities, can induce acne. It is also important to know that some lesions which appear to be acne are not acne at all. One skin condition that resembles acne is folliculitis, which occurs when the hair follicles become infected and inflamed. Folliculitis requires different treatment than acne. Acne that occurs in adulthood may be difficult to treat if there are multiple recurrences. Some patients with severe recurrent acne have undergone repeated courses of treatment with the potent systemic drug isotretinoin. Since adult acne may be difficult to treat, acne that appears for the first time in adulthood should be examined and treated by a dermatologist. What causes teenage acne? During the early teen years, boys and girls are at greater risk for acne breakouts, when the oil glands in the body start overproducing sebum, skin oil that can resemble grease. Adding to the problem, your body sheds dead skin cells constantly, and some people have sticky skin cells that don't shed normally, they just remain attached to the skin. In people who have acne, these excess skin cells mixes with the oil and plug up the hair follicles. The common myths. During the early teen years, boys and girls are at greater risk for acne breakouts, when the oil glands in the body start overproducing sebum, skin oil that can resemble grease. Adding to the problem, your body sheds dead skin cells constantly, and some people have sticky skin cells that don't shed normally, they just remain attached to the skin. In people who have acne, these excess skin cells mixes with the oil and plug up the hair follicles. The common myths. Quite a few myths are floating around out there about what causes acne. Let's straighten some out right now. Dirt does not cause acne. A blackhead may look like dirt plugging one of your pores, but that is not the cause. The sebum and skin cells mix together and sometimes rise to the opening of the pore. But the real cause is still deep inside the pore. Enjoy your chocolate and French fries. Indulging in these favorites does not increase the production of sebum in the skin. Some of you may have been told that sexual activity or masturbation can cause acne. Not true. Who gets more acne? While both boys and girls can get acne, it's more likely to be worse in boys because their bodies produce more skin oils. Strangely enough, your immune system can come into play as well, making you extra sensitive to the bacteria that get trapped in the hair follicles. What makes acne worse? If you use makeup, suntan products or hair products that contain oil, they can add to the pore plugging problem. Being under stress, like applying to schools, or struggling with grades, or even dating pressures, can help bring out acne. During a girl's period, hormone levels may create more sebum in the skin, which can worsen the breakouts. And, beware of the sun. Not only can it damage your skin and cause premature aging, it can also cause pimples. While keeping your skin clean is an important part of treatment, remember to be gentle, no hard scrubbing, no picking or squeezing. You can survive acne.